there's so many areas of leaf roll that have been so beneficial. It's kind of hard to put it all in a short, conversation. But patients like predictability, doctors like predictability, staff like predictability. So we gave access to the leaf rail board to our med surg units, so they know when their patients are going to go to surgery. We have a 35% add-on rate in our hospital. So, patients know and the staff know when to start getting them ready for surgery. If they know that they're predicted to go at 12 o'clock. The doctors, they get notifications if their case is delayed by more than 45 minutes, so they don't have to come out to the hospital and sit around and wait while we are trying to get their case in. That makes them happy, so it's just, efficiency is a huge part, but, and having staff satisfaction, patient satisfaction does, Loop Roll has a huge impact on that as well.
Oh my gosh, I cannot tell you how many times we have gone upstairs to go get a patient and the floor they it's no dig at them for not being ready. They have a lot to do, but they weren't informed. They didn't know and the patient still needs all of the pre-op work done and then we have the room ready to go. We're ready in the OR, but we have an hour to wait before that patient is ready to leave the floor for us to get them down there and time is lost when if there were better communication techniques, a better way to keep the floor informed, we could have maybe prevented some of that delay. Maybe not all of it, but we could have definitely improved it.